Hello, everyone. My name is Robert Bednars, and I am a junior doctor in Dundee, Scotland, and you're listening to the Patient Will See You Now podcast. I have to say, this podcast is for educational use only, and you should not be using this as medical advice or opinion. Please go see your doctor if you have any medical questions. This podcast is supposed to be fun and educational. So now that I got that out of the way, let's get into this week's topic. Hey everyone, this is Robert. In this week's topic, we're going to be talking about type 1 diabetes, if you didn't catch that from the title. So, diabetes mellitus, or just more commonly known as diabetes, is a group of metabolic disorders characterized by high blood sugar levels over a prolonged period. There are three main types, and the Hey everyone, this is Robert. In this week's topic, we're going to be talking about type 1 diabetes, if you didn't catch that from the title. So, diabetes mellitus, or just more commonly known as diabetes, is a group of metabolic disorders characterized by high blood sugar levels over a prolonged period. There are three main types, and the first two are so cleverly called type 1 and type 2, and then the third one, it's not type 3, it's called gestational diabetes, which is when you have diabetes only when you're pregnant. Today, we're going to be just focusing on type 1 diabetes, and this is when there's just not enough insulin being produced in the body, and I'll explain later why insulin is so important to us. Now, just a little bit of fun history, there is a logical reason why this disease is called diabetes mellitus. Diabetes is Greek and mellitus is Latin. And when translated to common English now, it roughly translates to the passing of honey. And by the passing, they mean urinating. So basically, peeing honey or just peeing something sweet. And that's because it was noticed that the urine of people who had this disease attracted ants. Later, before we had clever diagnostic tools to check glucose levels, prestigious doctors would allow their apprentice to taste the urine of their patients to see if it was sweet. At the time, this was considered to be an honor to do so. As a junior doctor myself, I'm really glad that I don't have to taste patients' urine to figure out if they have diabetes or not. So, of the world, 10% of the population has diabetes. And of those 10%, those people have type 1 diabetes, occur at any age. It's also usually found in leaner patients, but it's not exclusive. While I'm listing some of the signs and symptoms for you, I'll try and explain as to why some of these symptoms happen as well, because I just find the science of it all just so interesting. But first, I need to explain how glucose works normally in a healthy individual. When we eat a meal packed with fats, proteins, and carbohydrates, it's the carbohydrates that has all the glucose in it. While we're eating, our pancreas releases insulin from beta cells. What the insulin does is special. You see, glucose isn't just food for us to make our stomachs full and enjoy that pepperoni jalapeno pizza we just had, but every single cell in our body also needs food and energy, and that comes from glucose. However, cells don't have mouths the way we do. There needs to be a door so that glucose can get into these cells, and insulin is your magic key, almost literally. So, what insulin does is it acts as a key and it connects to a cell. This cell doesn't have a door yet. Once the insulin is connected to the cell, there are these vesicles inside the cells that move to the membrane and make magic doors appear and open so that glucose can get into the cell, so that the cell can use the glucose and make energy. That's literally how we get energy to eat, work out, walk, run, or swim, whatever you want to do. Glucose also never travels alone. Wherever glucose goes, water will always follow with it because glucose is osmotically active, which is just the fancy way of saying water will always follow where glucose goes. Now, I can mention to you the four main symptoms in someone who has diabetes, and they are polyphagia, glycosuria, polyuria, and polydipsia. glycosuria, polyuria, and polydipsia. So let me just go through each one really quick. Polyphagia has a bit of a more complex reason than the other ones that I'm about to mention, so I'll get this reason out of the way first. So polyphagia just means excessive eating, and this happens because the cells don't get enough glucose in them. So the cells start breaking down fats and proteins because once broken down far enough, you'll start getting ketones, which is super important to remember for later. And ketones is a way to get energy, but being in this catabolic state makes a person very hungry and eats more. But unfortunately, none of the glucose ever actually gets into the cells. This is also why a person might suffer from weight loss as well. So it's actually kind of strange that you could be eating as much as you can, but you'll actually lose some weight as well. Glycosuria means having glucose in your urine, and that's important because you're not supposed to have any glucose in your urine. So the only way of doing this is just by going through the urine, and that's bad. Polyuria is excessive urine. And like I mentioned before, wherever glucose goes, water goes with it. And if glucose is leaving the body through urine, guess what? So is urine. So you'll be peeing a lot more too, especially at night, which is really annoying. Polydipsia is excessive thirst. And this is because since there's so much water leaving the body from you peeing all the time, your cells are now also getting dehydrated, and so is your body. And you try to make up for it by drinking liters or even gallons of water. So, with all that, I can talk about something called diabetic ketoacidosis. And this is really scary for some of the patients. Remember when I was talking about those ketones earlier? Well, let me tell you what kind of damage they can do as well. I know it sounds like everything can cause damage to a body at this point. But ketones is a plan, but it sounds like everything can cause damage to a body at this point. But ketones is a plan B for the body for getting energy. However, what sucks about ketones is that it's very acidotic and it decreases the pH of a person's blood. And when the pH gets too low, the blood becomes acidic and it can start causing a bunch of problems. This usually has a trigger, and that trigger can be some sort of stress or even infection. The pH will drop significantly, and the patient will suffer from vomiting, nausea, extreme thirst, abdominal pain, and you'll sometimes find someone breathing very deeply because that has a mechanism in itself trying to balance the pH of the blood again. This can be very fatal if not treated correctly, and unfortunately, this is usually the way most people find out that they have type 1 diabetes. A sweet thing about DKA is that the person's breath will have a nice fruity smell to it. But that's pretty much the only thing sweet is that the person's breath will have a nice fruity smell to it. But that's pretty much the only thing sweet about this. So without getting into too much details about the complications of diabetes, having too much glucose in your body can cause a whole range of damage everywhere. And I'm just going to list the complications starting from the head and then to your feet. So, stroke due to an atherosclerotic process, retinopathy, cataracts, glaucoma, problems with the eyes, cardiovascular diseases, including hypertension, silent heart attacks or silent myocardial infarctions, congested heart failure, gastroparesis, which is just feeling full quickly since you can't empty normally, nephropathy, which is a pathology of the kidney, and this is a huge deal in diabetics because we're so afraid of end-stage renal disease in diabetics. Impotence, very important for most people. Peripheral vascular, the ends of your limbs or pretty much anywhere, and diabetic foot. And this is when a person starts getting ulcers and infections in their foot due to both artery disease and nerve disease from diabetes. So when it comes to treatment and management, when someone's pancreas isn't making enough insulin, the best drug to give that patient is, you guessed it, it's insulin. Nowadays, people just get the insulin injections and inject themselves subcutaneously. And they usually give themselves the insulin 4 times. One of them is the long-acting insulin, which is given at night to get a nice baseline glucose level. And the other 3 are taken usually around 15 minutes before their meals, breakfast, lunch, and dinner. Normally, a person without diabetes should have their glucose levels to be less than 100 milligrams per deciliter. But for diabetes, we want to see their glucose levels controlled at around 140 to 180. These insulin shots can be given in the arm, leg, abdomen, or butt just places that have a good amount of cushion. Can be given in the arm, leg, abdomen, or butt, just places that have a good amount of cushion on there. The main side effect that we worry about is hypoglycemia, or too low blood sugar from an accidental too high dose of insulin. Otherwise, insulin is a pretty safe drug. Instead of injections, some people might opt for the continuous pump and make sure there's a correct dose of insulin going in them before every meal without having to inject themselves every time. The technology we have for patients nowadays is pretty awesome, and you'll see for yourself in the following interview where I speak with my good friend Corey and his journey living with type 1 diabetes.
Hello.
Good morning, Corey. How are you?
I'm good. How are you, Robert?
I'm doing great. So as you may know, this is Robert from the Patient Will See You Now podcast. And for everybody that's listening, Corey is a longtime good friend of mine. We go way back, being in a band together, playing some rock and roll music across the United States. And Corey has been kind enough to be a guest on this podcast today to talk about his condition, which is type 1 diabetes. So, Corey, just to start it off, how about you just let everybody know, how did all this start? How did the symptoms start? When did you notice something was kind of wrong? How old were you when this happened? And we'll take it from there.
Okay. My story is a little bit interesting uh, because people tend to learn that they have type 1 diabetes pretty early on. Uh, I was told this February, so that was February 3rd, 2019. So I've only had type 1 diabetes for roughly, that's 11, 10 months. And when I was first diagnosed, and like the reason why I found out how, there were a handful of things that were happening. I did not know what extremely high blood sugar felt like, uh, what those symptoms were actually telling me, but I was feeling relatively weak all the time. I was urinating frequently, thirsty constantly, and losing a ton of weight relatively quickly. I had just changed into a new job. I was working pretty rigorously. So I was like, oh, this new job, it's like really kind of like was in a state of ketoacidosis where my body was actually burning off all of the fat that was on it. So one day I woke up and I started to like vomit for several hours from like 3 a.m. till about 9 a.m. And I went to an urgent care facility. They tested my blood sugar and I was in I believe the 350 range easy. And then they decided, hey, you need to go to the hospital. We gotta get you tested.
At what point were you actually like, I think I need to go see an urgent care? Like, was it the weight loss? Was it the vomiting? What was it that made you really want to go and you got worried that, oh, this might be something more serious?
I would say it was 100% the vomiting. I definitely like hit a point where like I was like, oh man, this is some really bad food sickness or something, but I was wrong. I just like no matter I thought uh drinking like speaking to like a teledoc system, like even like that my insurance allows me to have, I was able to like talk to someone. I was like, hey, I feel relatively weak, should I see a doctor? And they're like, try some magnesium, try some like I'm like blanking on the beverage, but like some like Gatorade or something to that status. But yeah, try and figure out. And then I like the vomiting went on for a really long period of time. And then after I actually had stopped vomiting, I had a very sharp pain in my kidneys and in like my back. So I was like, I couldn't walk, and I just like my partner essentially carried me to the urgent care facility.
So the teledoc thing, that's pretty interesting because it's different from what I'm used to as well. were did they ask you questions like, "Oh, do you have diabetes?" or do you, anything like that?
Yeah, no, they totally asked me some pretty straightforward questions. Um, I mean, my descriptors probably weren't accurate enough to be able to portray what I was actually feeling, or like, because I didn't know what I was actually feeling. Yeah, I just told them that I was like feeling really lethargic, like I couldn't finish a hike. I like my legs were kind of cramping, and I was more or less talking about my achy body more than like my weight loss and like how I was feeling. And like the teledoc was before the vomiting. The vomiting happened like literally probably the next morning.
So at this point, you're just thinking that it's because of your new job, you're lifting a lot of heavy things. From what I remember you telling me before, you're just moving around a lot. I remember you telling us too in our chat that you were just like losing a lot of weight, and you think it's from work, right? You were just thinking it's from work the whole time. You were just thinking it's from work the whole time.
The whole time, yeah, because I like honestly wasn't weighing myself. My I coffee having some like lifting, moving 150 pounds of like, coffee in like a burlap bag and basically wheeling it across a warehouse and dumping it into a roaster for hours on like all day long. So there's this thing where it's like, oh, I it's not that I felt like stronger, but I was just like I felt leaner, because I was just like, oh, I like just busy running around doing things, and then I didn't realize it. And then when I finally did weigh myself, I was like, I'm getting down there in weight. It's starting to look concerning. And I remember when I told you that I was just like, oh, this new job, I'm like, I lost this much weight. It's like, how long? And you said that, how long have you been working there? I was like, maybe it's been a good 2-3 months now, maybe. And then you're like, yeah, no, that's not healthy.
um, yeah, I remember that completely. And then what you never told me was at the time was just that you were urinating at night. So you must have been just urinating constantly, right?
Yeah, that was the very uncomfortable part of it, is dealing with the fact that I was just like, oh man, if I like get home by this time, like, will I have enough time in my drive to make it home safely, or in the most like appropriate way possible, like just trying to get there in time, like, will I make it? Yeah, it was a very uncomfortable feeling. I was urinating frequently, but I was also like drinking a ton of water. Like I could probably drink like a 32-ounce water bottle in like chugging it, and then chug another one directly after it and not feel like satiated, which was wild.
Yeah, that's exactly what happens. You're what everything that you're explaining is like a textbook explanation of DKA and type 1 diabetes.
Yeah, I definitely was not aware of that.
So you got to urgent care and what happened there?
I told them about my vomiting. I told them about like my weakness and like what I was feeling. They basically like gave me something for the nausea, and then they were like, "Hey, cool. So, can we? Do you mind if we take some blood samples and like test them?" So they did, and then after a little bit of waiting, they were like, "Cool. So we called you an ambulance." And
Just
I
like that,
didn't
they just
at that.
said we called you an ambulance.
They were like, you need to go to the emergency room. We do not like. They told me they did not have the proper setup to like basically bring me down from how high my glucose was at that moment.
So they were telling you though that hey, your glucose is really high.
Not initially. They were just like, "Hey," like they then like followed up with the questions like, "Do you have any history of diabetes in your family? Do you know anything about like that running in your family? Like, what do you know about diabetes?" And they were like asking me questions to like kind of inform me, and I was like, "I don't know." They're like, "Well, yeah, so we called you an ambulance, and we think that like they're like you are trending really high in a scary direction, and we would very much like we like this was the step that we have to take safely to make sure that you get out of here.
So an ambulance comes by, it takes you to what happens there.
Um, my paramedics were very sweet. They rolled me right in through the back door. I immediately was helped by a bunch of very lovely emergency room like assistants and techs, and everyone was very, very like calm and patient in this wonderful way where they were like, hey, so what you have is something called DKA, diabetic ketoacidosis, and they went on to explain what was happening in my body in a really like logical way. And I was like, I wasn't scared in that moment. I was just like, oh, this is happening. This is strange. How did I end up here so quickly? Um, and yeah, they then like put me on a bolus of insulin, and they went on to then like tried different numbers at a certain period of time, and then just trying to recall, then they ended up putting me into, I forget which ward it was, but they definitely put me up in a room, and I hung out there for probably, I was in the hospital for about a week.
By any chance, was the room like called high dependency unit, HDU?
I don't know if it was HDU. I don't know. Maybe I forget which one. It was definitely not that, but it was definitely a urgent ward. And I remember like I was the only person in that area, which was really interesting. So
That must have been scary as well.
yeah, a little bit. I was just like, oh, this floor is like real quiet. Everyone's kind of hanging out with me a lot. This is really interesting. I don't know what's happening.
So you just said you don't know what's happening. When did you actually realize, like, when was it perfectly clear what's going on and what you have and what's about to happen?
At like when they put me in the room, like when I was leaving the emergency room like area, they very, very much explained to me exactly what was happening and how I'm gonna have to like make some changes in my life. And they were like, you can't like you can't necessarily do this, you can't do that, but going forward, like everything's gonna be okay. And then like we're gonna have our like a diabetic specialist come up to your room, hang out with you, and educate you. Like basically, an educator will just come to you and run you through the whole gamut of like how to get started and how to learn.
So is that where they told you that you're type 1 diabetic?
Yeah, I mean, they weren't sure if it was like because in that moment they can't really they didn't really run any type 2, and they weren't gonna like put a finger down on either one. It was towards the end of my hospital stay where speaking to a few of the diabetic specialists and getting like tests done, they were like, okay, no, you are type 1 because of X, Y, and Z, and this is going to be the rest of your life.
So how did you react when they told you that you have type 1 diabetes or in general that you're a diabetic patient? How did you react to that?
I don't like thinking back on it. I don't know how I responded. I very much I feel like I took it in stride, but I was just kind of like, oh, so what does that mean? What do I do? Like I was more curious than anything. I just was. It's like something was like, okay, that's something I got to work with now, I guess. It was pretty scary, but I would say I tried my best to hit the ground running to try like start getting all those questions that I could.
So were you kind of taken aback? Because I think I remember you telling me too at the time that you don't really have any immediate family members that have diabetes, right?
Yeah, at the time I did not know. So when I was in the hospital, all the way up until like me sitting in my hospital room, and like talking to my family, because like I live in California now, my family's back home in New Jersey, and I'm like having my partner call them, text them, update them. And I found out then after the fact that my father is actually a type 2 diabetic, and I did not know that. at the time. It's funny because it's like something that like he's just been like kind of like living with and handling and doing him and like on top of the situation, but I had no idea. But also apparently his side of the family trends with type 1.
And that was just all new information for you at the time.
All new information. There wasn't as much transparency as far as that stuff because like I like when it comes to my father's side of the family, um, like me and my father are very close. I wasn't like growing up. I wasn't asking the questions like, what do I look out for? Like, what's gonna happen to my like X, Y, and Z? You know?
Hmm. So while you were at the hospital, do you have like some results, some blood results of what number? Like I'm more or less I'm looking at your glucose levels, your ketone levels, and your blood pH.
I can, yeah, I definitely have access to all of my metabolic panels and all that kind of stuff. I could tell you that easily that that the first blood, like the blood glucose result that happened when I entered the hospital, I was at 375.
And was this at urgent care or at the hospital?
This was when I got to the
When you
hospital.
got to the hospital. Okay.
Yeah.
So do you know
Um,
normally what level you're supposed to be at in glucose levels? Did you know anything about glucose levels before going in there?
Honestly, no. I found out after the fact that like normal levels for a person without diabetes is like, and you could correct me if I'm wrong, between like 70 and 99.
Yeah,
Like,
it's different it's a little bit different everywhere else, but yeah, that's more or less on the spot.
okay. And then as far as I know, like because like with type 1 diabetes, based on like my diet, uh, basically how my body responds to almost anything I do, my glucose level has a chance to rise and fall, but more likely rise and rise and rise and rise and rise. But I know now that I'm supposed to keep it within the levels of like 75 to like 150. Like keeping it under 150 is really kind of my goal. As far as like, at least that's what like my educators have all told me, and like they told me that those are like kind of the appropriate levels for me to stay within.
Hmm. So when you got there, the first blood level glucose, you said it was like 350. Was there more? Was it ever higher than that?
Oh yeah, no, I've definitely felt it at 450.
What do you mean you felt it at 450?
It's definitely like there are times where, at least like since in my like treatment, and like as far as like my like insulin therapy that I'm like kind of working with, I'm trying to keep it low. There are times where like I may eat more than I think I do, or like uh, mismanage like how many like carbohydrates my body's actually like processing. So if I eat too much and I don't give myself enough insulin, I can see that number kind of rise to some scary levels. Or if I uh, forget to take my insulin, that is also a thing because there's like two types of insulin that I do take. One acts as a long acting background insulin to keep my levels kind of like in checked, like within like a set of kind of like parameters, like two kind of bookends. And then every time
Do you have like a potassium level? Because interestingly, when your pancreas isn't producing enough insulin, insulin is also very important not only for glucose but for potassium. So potassium can get into really high levels as well in a diabetic patient. Do you have a potassium level?
yeah, that was 5.3.
So the border is usually like around that, like that's the higher side of potassium,
Yeah,
pretty much. And
like yeah,
that
to
could
my
that
knowledge.
yeah, that could be really scary as well if it gets too high. We're worried about heart conditions then when potassium gets too high. So usually when a type 1 diabetic comes to the hospital with DKA, which unfortunately is how most type 1 diabetics find out they're type 1 diabetic, is through DKA. Their glucose levels are usually off the charts and potassium levels are really high. So we try glucose levels are usually off the charts and potassium levels are really high. So we try to lower it. And then lastly, what we're trying to look at is your blood pH. Do you remember? Do you have a blood pH number?
Yes, I do. That blood pH level was 7.022.
And when you told me that, my jaw dropped because that is a very, very acidotic blood pH. Usually we try to keep the numbers between 7.35 and 7.45, which is the physiological pH of blood that people should have. And you are just getting into that really acidotic state. And that's where most of the problems can come from, is when you have your glucose really high up and that acidotic state as well. Like, do you remember what were you feeling at the hospital? Do you remember?
Upon entry.
At the hospital, do you remember?
Upon entry, like I was having a lot of trouble breathing.
What was your breathing like, actually?
It was very short. It like I had like it was very like short. I wouldn't say fast. Like I was just kind of like fighting for to breathe a little bit, to the point of where like I felt my lungs like I the best way to describe is that I couldn't feel the bottom half of my lungs.
So were you making like deep breaths or shallow breaths?
Pretty shallow because I was trying to do deep breaths and couldn't.
So that's so interesting that you mentioned that, because this is actually something called Kussmaul breathing, and it's a mechanism for when your blood pH gets so acidotic that you're trying to compensate by by trying to expel carbon dioxide faster so that your pH blood can go higher. So that is a very pH blood can go higher. So that is a very compensatory mechanism that our body has. When we get acidotic, we try to do this breathing more to try to get our blood pH back up. So that's really interesting that you actually mentioned that.
Yeah, it was wild.
So okay, so now after all this, and then the diabetic doctors came by and they trained you on all insulin management and stuff like that. Do you? So we could start talking about your insulin. Let's talk about your insulin now, and how does that work? You said you mentioned before you have a long acting insulin and a short acting insulin. Can you talk about when do you take those? How often do you take those? Where do you take those?
Yeah, sure. To my knowledge, currently there are two pretty like widespread ways of treating your insulin with, or treating your diabetes like with two pretty like widespread ways of treating your insulin with, or treating your diabetes like with insulin. There is like, you could either have a small pump that is attached to you that you kind of like dial in and like punch in numbers and are able to kind of like dose out your insulin kind of through this little mechanism. It's very handy, it's very cool. Learning how to give myself insulin, I'm currently using something called MDI, or multiple daily injections, where I have little like kind of pens that I put needle tips onto, and I just kind of inject insulin into my torso or the tops of my legs, just because those are the two easiest spots for me. Um, so it's like, yeah, kind of like my abdomen area going around my belly button, and then like, yeah, the tops of my legs. And yeah, so the two, I have the one which is like my background long acting insulin, and then I have, and I take that like every night. I take it at like 9:30, and I just kind of like, it helps control my glucose levels as I sleep, and also like when I wake up, and kind of like in between meals, more or less. And then the other one I take based on how much food I'm eating. I'm able to give myself a rubric. Like I kind of do a little bit of math in my head, like, oh, okay, so I check my blood sugar first. I see where I'm at. If I am past a glucose level of like 150, um, I give myself, well, yeah. So yeah, it's like it's to backtrack a little bit of insulin with this pen per 15 grams of carbohydrates. So if you were to look on the back of like a Pop Tart and it says that one pastry is 28 grams of carbohydrates, I would take 2 units of insulin for that one Pop Tart. Um, yeah,
So
and
that
then
that is that does that mean every meal it's a different amount of units of insulin that you take?
yeah, like lately I've been sticking to eating a lot of the same foods just because like I'm kind of dialing it in and making sure I'm not kind of like going to give myself any curveballs. But that doesn't mean like I'm not afraid to try new foods and see how my body reacts to it. It's a lot of learning, and like that's all it's been, honestly. So
So
it's
when
a
you
lot
when
of
you go, sorry to interrupt, but like when you go out to
no.
a restaurant with your partner or your friends, and you want to order some food like some pizza or some pasta or something that's full of carbohydrates, how do you? There's no nutritional value. They don't tell you that this has this many grams of carbohydrates. How do you try to manage like, oh, I need to take this much insulin before this meal?
Well, some of it there's a little bit of guesswork, but the majority of it is like there are some kind of like golden standards you can go to. Like if I want to go get a hamburger, um, I would give myself insulin based on some parts of that meal and not others. So, like carbohydrates are coming from like kind of like some pretty like fibery or not fibery, but like some kind of like grain based things. So like the part of that hamburger are the buns. So I'd give myself probably like a unit of insulin for like this much bread. And I know that based on either A, how my body has reacted to hamburger buns or bread in the past, or there's been a lot of like very great kind of like stuff written out as far as like how to measure like these kind of foods. Like the second half of meeting with an educator was I met with a nutritionalist and they were able to tell me like, cool, so you will be able to see if you go out to eat pizza has this much carbohydrates, so how much insulin do you think you would take? And then I would answer and kind of quiz me a little bit about it and make sure I was able to kind of decipher some of those scenarios. And like since then I feel like I've been pretty comfortable going out and eating like what I want and knowing how to give myself the insulin based on that.
So you haven't had any really big restrictions on what you can eat. You can still pretty much eat whatever you want as long as it's controlled.
More or less, because like that, I mean, that's one of the biggest kind of like things, or like just like a common thought about diabetes is like, oh well, with type 1 at least, like, oh, so and so is not allowed to eat that because they're diabetic, and that's not the case. It's actually like you can control how your glucose levels reacts to some of the food based on like how much insulin you take. So it's like at this point in my life, my doctors feel pretty comfortable with like my diet. I've like gone over it with them and they're like, yeah, no, if you want to eat that hamburger, if you want to eat that pizza, go party on, like it, like you just got to make sure that like you know exactly how much you're giving yourself, or like even how your body's going to process it, because like some foods might attack you, not attack, but some foods might affect you later, like sooner or later. So it's like some more complex carbohydrates take longer to break down, so your body might process them a little bit slower.
And I know that because we talked about this earlier before, but I just want everyone else to know. Um, how do you check your glucose levels before you actually give yourself the insulin?
So there are two things that I do, kind of like one that I have pretty regularly, and then the other I do as kind of like a backup check. So currently I use a patch on my arm called Dexcom. Um, it is like their latest model is called the G6. It is a little kind of like plastic receiver that like sends a little antenna, just sits underneath my skin, and it's like stuck to my arm with an adhesive, and it actually sends my glucose levels to my phone every like 5 or so minutes. And if I'm going too high or if I'm going too low, it'll send me an alert like, hey, you need to eat something, or hey, you should probably take some insulin. It's definitely called to like raise alarms at like really funny points in my life at this time, but I'm still figuring out how to deal with that. Um, but I would say the other one is I just have a glucose meter that I just kind of like have a little like kind of like lancet that will poke my finger, break the skin, allow like me to draw some blood. I put that blood onto a strip, and the strip sits inside the glucose meter, and the glucose meter will like kind of just like take 5 or 6 seconds and give me a reading back.
Do you also check your ketones as well?
Currently, I do not. My doctors haven't really seen a call for it at this point, based on like results of some of my tests, and like as far as like my bouncing back from like my stint at the hospital so many months ago. They were like, no, like you're healthy, your diet sounds good, like if you have more questions, like please let us know. If there are other things you want to check, go ahead. But yeah, I don't think there's been a call for me to check any of my ketones.
Did they also mention how you need to stay away from certain diets? Because I know, for example, the keto diet, for example, is really popular.
Yeah. That is basically a diet I cannot do, because like hitting that stage of ketosis like would definitely kind of put me, like my body would react to it to the way that like it would as like what put me in the hospital initially. I would kind of like my blood sugar would kind of like rise and rise and rise, and then I would just be kind of like fighting it to come down.
So it's interesting that that type 1 diabetes almost forces you to have a diet that needs to have carbohydrates in it. Have carbohydrates in it.
Yeah, there's definitely like a like kind of a balance to it, because it is a bit of a dance at that point. Because there are good carbohydrates and there are bad carbohydrates, but you just want to make sure that you're just like keeping everything in balance more or less.
Have you ever mistaken how many units you gave with the insulin? Like, did you ever give too much or too little, and then you realize you were actually going hypo or hyper?
Oh yeah, totally. That's part of the almost like it's definitely a learning scenario. My first very terrible low, um, it's like the I don't recall what I was eating. I think it must have been like I cook a lot of rice. I like 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 fry up a lot of veggies and stuff, and I try to do a lot of my cooking at home. But I guess I ate far less than I thought I did based on the insulin I gave myself. So I gave myself too much insulin, and what had happened was I went hypo, and my numbers were dipping south of like 70. So I was going into like the 55 to 65 range. And like checking that on either like that patch in my arm that sends my signal to my phone was like yelling at me. And like to double check, I checked my like on my glucose meter, and they're like, dude, you got to eat some food. So the one of the easiest ways to deal with that is like orange juice, or like even like a Coca-Cola or something, or like some sort of like soda, just some like kind of quick carbs. As far the thing is when you are in that state, you're not thinking, uh, period. Like you just are like craving, and like when you hit a low so drastic, you kind of uh, look at your fridge and you go top to bottom, and you're like, how fast can I undo this feeling? And how fast can I eat this like sleeve of Oreos? And how much ice cream can I eat? You're not even thinking about like numbers, how much you need to eat to get yourself back to a good place. You are just thinking about, I need to get out of here. I need to bump that number up. I need to feel better.
So that's actually pretty interesting too. What were you? Do you remember what kind of symptoms you were probably having when you hit that hypo level?
Yeah, there's for me there's a like weakness that happens. I get so trembly, I get so shaky, and like then there's like also kind of like I don't want to say like it feels like I'm drunk, but like there's definitely like a wooziness to it. And like in that point, like where I'm where I was talking about like not being able to think straight, like yeah, it's like nothing. I like there's not. I didn't hit a point where like I was not making sense with how I was talking, but I was repeating myself a lot. It's just like weird kind of like things that were just happening. It was very strange.
No, yeah, that definitely makes sense. When your glucose levels gets too low, there is a sense of confusion kind of happening. So do you always have like an emergency Coca-Cola with you at all times or something like that?
I mean, if you have more conversations with more people who are type 1, you'll see that people have like a favorite or like a back them. Like because they know how it like how they process it, they know how they handle it, they know exactly what's going to do to them, how much they need to eat, and how fastly it'll affect them, just in case.
So what's your
Um,
snack?
Mine have been. There are these. So by me, there is a supermarket called Berkeley Bowl. It is the greatest place on earth. They just have like one of those great areas that are filled with like loose bags of like nuts, whatever, like grains, and like then underneath that there's a bunch of bags of like candies, and there are very specifically these little like flour gummies that I eat all the time that are like perfect size shape. They don't melt. They come bagged. It's wonderful. They kind of like they've saved me many a day, and like if not at work all the time, if I ever hit like bottles of Coke like in the fridge.
So at least you have something ready at all times, kind of like an EpiPen. For some people who might get an allergic reaction, they'll have that EpiPen ready, whereas for you, it's that those gummies, right?
Yeah, totally. Yeah, like that. Yeah, that stuff's like super important. You know, I need it.
So I had one question as well for the beginning, because usually type 1 diabetes is usually found in a younger population. So usually, because it's an autoimmune disease, um, kids usually I was just in pediatrics for 4 months, and I always see kids coming in, and unfortunately they come in with diabetic ketoacidosis, and managing that is very stressful because we're trying to get their pH back up and their glucose levels down, and then it's a whole level of teaching the kids and the parents how to manage diabetes and so on. First of all, how old are you now? Diabetes and so on. First of all, how old are you now? How old were you? Well, yeah, I guess were you? I guess it's the same year, but how old are you now that you when you found out you have type 1 diabetes?
Yeah. So it was this year. I was 28 when I was diagnosed. I'm 29 now. Yeah.
That is a bit older, which is interesting because usually it's interesting that that you were a little bit older than the normal population who got type 1 diabetes because it's usually found much earlier. Do you know if something maybe triggered that state of diabetic ketoacidosis? Like, were you very stressed, or maybe did you get some recent infection or anything like that?
To my knowledge, no. I like honestly, it was like kind of a thing where it's like, as far as I know, this was a thing that my pancreas was like always kind of fighting with. Um, I I either never noticed it fighting with. Um, I either never noticed it or my body like it was like kind of like operating at a minimum my entire life. You know, I wasn't exactly sure like what caused it. I do I definitely like recall the meal that I had the night before I got like terribly sick and was throwing up. So it's like I was convinced it was food sickness. But it wasn't, and here I am now.
So, in terms of diabetes and for your future, because unfortunately, type 1 diabetes, there's no cure for it. So this is a lifelong thing that you're going to be living with. Do you have any fears, or does that affect you at all? Does that, like, how does that process in your mind?
So it was like with learning what type 1 diabetes was at length, from like my educators, there have been like several great resources that have been able to like teach me more, and like, because if there's anything like I took away from it, was just like, cool, if I have it for the rest of my life and like, I can't get rid of it, I'm gonna work with it the best that I possibly can. I was taking out medical textbooks from the library just to see what type 1 diabetes was, how it's treated, XYZ. And then like I went to whatever kind of function there was in my area. There's a great kind of like gathering of diabetics, both type 1, type 2, and then also like their supporting partners, which they call type 3, which I think is adorable. Um, and they very much like separate kind of convention into type 1s and type 2s, and they have different kind of like lectures and like information sessions and like sit downs with doctors about like different things that you might want to learn about the disease you're going to live with.
So, do you also know that there is a chance for your kids, your offspring, to also have type 1 diabetes?
Yeah, totally, 1,000%. And it's just about like being able to learn a way that I teach it as quickly as I've learned it, and also just like knowing that it's just a thing, and honestly spread as much education as I possibly can. Um, yeah, it's definitely a thing that like given like down the road when I choose to have kids, definitely like talk to any medical professional I can to like be like, cool. So is my kid diabetic? Is my kid diabetic? Is my kid diabetic? And like I like
It's
see like how it shows itself if it does.
it's actually, I think, when I see the kids in the pediatrics ward before, there was just a lot of kids who were diabetic and their parents just weren't, so they didn't know what the signs and symptoms could be. Whereas you're at an advantage, and if your future child might have type 1 diabetes, I feel like you'll be able to catch it earlier now because you know exactly what it looks like. You know what the signs and symptoms of diabetic ketoacidosis, and you're like, nope, we have to go see a doctor now. I think you're at a total advantage now of what it looks
Yeah.
like and helping them out.
Yeah, like 1,000%. That's definitely like I definitely feel well equipped. Um, and I like, yeah, it's about just like taking it for the long haul.
So I guess we're gonna wrap for people who are just diagnosed with type 1 diabetes, or if they know somebody who's type 1 diabetes, what kind of advice could you give them to help them go through this journey?
I would say first and foremost, have someone that you feel comfortable talking to about it. If you just found out you are type 1 diabetic, find somebody that you might know that might be type 1 diabetic and ask all the uncomfortable questions, because that stuff helps. Um, and like you just need to make sure that you have a good care team. Make sure that the doctors you have you trust and you can talk to frankly and honestly, because there's a lot of weird things that happen on the outside of diabetes that happens because of diabetes. Also, there's a lot of great information out there. Like the diabetes.org website for the American Diabetes Association has so much incredible information and so many great suggestions. And then earlier, it's called Taking Control of Your Diabetes. They go around the states. They have great little like retreats. They have great kind of like lecture series. There's a lot of wonderful information there. tcoyd.org.
Great. I'll be sure to put both of those links in the show notes so that they can people who are interested, they could find out and read a little bit more about it. It's really nice that these things are available to everyone to know more about their condition, to know more how to stay safe, to know more how to keep your glucose levels in check and how to live a normal, regular lifestyle, even though you have this lifelong disease.
Yeah, it's definitely doable. I'm definitely like learning that, and it is a process, but I know it's possible.
Corey, thank you so much for being a guest on this podcast. I really appreciate it. Is there anything else you wanted to mention?
Um, I would just say, thank you for having me, Robert. This is wonderful to be able to talk about this stuff like this in this kind of like avenue. And then also, yeah, just a quick thank you for anybody that has taught me and has cared for me in this learning time in my life. It's been pretty wiry and pretty crazy, but a lot of fun in a weird way. I've definitely been learning and yeah, just taking it.
Thank you so much, Corey, and I'll talk to you soon, all right?
Okay, bud. Thank you.
Have a great night. Bye. If you liked this episode, please leave a review and also make sure to subscribe or follow on whatever platform you're listening to this on so you can catch the future episodes as well. If you want to be a guest on this podcast,